Can I show you guys what my poor massage table actually looks like these days? It's become something transformed. But I picked a page, any page at all, and here we are. I had to have the light on because it's raining and kind of dark outside. So here we are looking at the sacrum from the back. Here's the bottom of your lumbar spine. Here's your sacrum. Here's your tailbone. Where's my pen in this mess? Okay, so here's your tailbone, right? So I want you to look at this. This is a really interesting ligament I'm about to show you. This over here, here's your hip bone, right? Here's your hip bone, and here's your sit bone, okay? Or your ischial tuberosity, which is its real name. This is a ligament that goes from your sit bone up to and attaches just a little bit above into the sacrum, just above the coccyx. This is the sacrotuberous ligament right here. I want you to notice that the ligament goes from the sit bone to the side of the sacrum, but it also merges into all this other very strong ligamentous structure that's happening on the side of the sacrum and also attaching to back of the hip bone as well still. So you have all this really strong ligamentous attachment that's happening because there's a lot of support that's needed here. But the thing I'm going to point out to you, although I should probably find a picture of the hamstring that's kind of interesting, here on your sit bone, maybe I'll try to do that, on your sit bone here, what happens is that your hamstrings attach to the sit bone. And when you look at a picture of the hamstrings themselves, they actually merge into this ligament. So how interesting is it if my sacrum is out of place? It's going to put a torque onto this that's going to have a response into my hamstrings. Or if something's going on in my hamstrings, it's going to put a torque onto my, or a pull onto my ischial tuberosities, and it's going to change the nature of this ligament and pull my sacrum out. So you have it going either way. I can have it be something dysfunctional here, goes down and goes through and into the hamstrings, or I can have something in the hamstrings going in dysfunction and actually going the other way. It's an interesting kind of deal here with these ligaments. I'm going to get a little bit closer and show you another little couple of ligaments here. They're actually called the same ligament, these iliolumbar ligaments. They're attached to, this is your L4, your fourth lumbar, this is your fifth lumbar, and there's a ligament in here that attaches just to the transverse process, which is the little wing guy. This is the transverse process of your L4 and 5, and then it comes and attaches on the hip. It is super common to have so much tension in here that it pulls the hip in tighter and closer and won't let the hip actually function well. I mean, it's a little not known or actually not put into the equation very much when you're trying to help somebody and help them get function and weight bearing into the hip bone, because that's what you really need to do here, is get weight bearing into somebody's hips. So I hope this was a good little one this morning, looking at how the ligamentous structure that goes from the sit bone to the sacrum really can impact hamstrings and vice versa, and also how you have this ligamentous structure also attaching on your iliac crest of your hip bone, and how that can actually pull you closer and create some lack of movement and lack of function. So you guys have a great day. I hope it clears up. It looks like the sun is kind of coming over the horizon. I'll show you my little, out my window of my treatment room. It looks like it's getting a little light back there. Alrighty, have a great day. Talk to you guys soon.